Good afternoon, all. Am I audible? Is my screen visible? Please mention in the chat box. So today's topic is dietary fiber, chapter 4, page number 47 in the old textbook. In the new textbook, it's page number 49, I guess. In 8th edition, it is page number 49. So if anyone is joining late, please help them out with the page numbers. So dietary fiber, they can be usually classified into three main categories. One is your non-starch polysaccharides, resistant oligosaccharides or resistant starches. Okay. And resistant oligosaccharides also have the same function that they stay back and get fermented in your intestine. Okay. And resistant starch as well. They stay back and get fermented in your intestine. Okay. So these are the three main classifications of dietary fiber, but usually we use the soluble and insoluble classification, which is the functionality of the dietary fiber. Okay, dietary fiber is also carbohydrate, but you will not get energy from this carbohydrate because it is not going to be metabolized or broken down for energy. Okay, this fiber, it's very complex carbohydrate. It is carbohydrate. It is also supposed to give 4 grams or 4 kilocalories of energy, but your body cannot use it for energy. Okay, it can be used up only to create the bulk in your fecal, okay, feces, and to alleviate constipation, cholesterol issues, to make sure your gut motility is there. Okay, and to make sure that vitamins and minerals reach your intestine. So these are the main areas where dietary fiber will function. Dietary fiber will not function to give you energy, even though it is a carbohydrate. Dietary fiber is a very complex carbohydrate. Okay. And it is derived from your plant cells, which your body cannot break down. Okay. The plant cell wall and all. In other herbivores like cattle and all, they can break down. Okay. But human intestine cannot break down the plant cells. So the enzymes that we have and all, they cannot hydrolyze or digest these plant cells. So the major functional classification of dietary fiber: soluble dietary fiber, insoluble dietary fiber. Okay. Soluble dietary fiber, they are fermentable. Okay. And they can be viscous or non-viscous. Okay. That is the way how they gel up, they make gel. Okay. The psyllium husk and all, they come under this category. If you put isabgol or psyllium husk in little bit of water, it completely converts itself into a gel like constituency, right? That is soluble dietary fiber. Okay. Soluble fibers, they cannot be digestible, but they are soluble in water. They get dissolved in water, but they are not digestible. Okay. And insoluble dietary fibers, again, they are also indigestible. Your body cannot digest them, but they are not even soluble in water as well. Okay. So that is insoluble dietary fiber. So always remember, any fiber that when you expose it to water, they will form a very thick gel-like substance. Okay. So that is soluble dietary fiber. It has to form that thick gel-like substance, like psyllium husk is a good. Okay. And a lot of plant-based food naturally has this soluble dietary fiber. Majorly, soluble dietary fiber can also lower your blood cholesterol level. It can regulate your blood sugar level as well. And it makes you full. Okay. If before eating your lunch or dinner, just take a teaspoon of isabgol and, yeah, have it before you eat something. Okay. Eat your main meals. You will feel full with small portion of meals. Okay. That is the function of the soluble fiber. It will create this gel-like consistency, because of which you will feel satiated. Okay. And it can also support your gut health, your microbiome. Okay. It acts like a prebiotic. And when, as soon as you have the soluble fiber, the gel-like fiber, the gut microbiome will go and eat it up. Okay. That is why it is fermentable. It reduces your risk of heart diseases as well. Usually, you will find soluble dietary fibers in fruits like apple, oranges, bananas, pears, berries, vegetables like carrot, Brussels sprouts, and sweet potatoes. Okay, they have soluble dietary fiber. Legumes like all your dal, lentils, beans, peas, whole grains like oats, barley, flax seeds, psyllium husk. Flax seeds also, like if you boil flax seeds in water, it gives you that gel, right? If you have used this technique for hair care and all, flaxseed gel, widely used. Okay, you boil some flax seeds in water, it converts that water into a gel. That is why, because it has this soluble dietary fiber. Okay. Pectins, glucans, gums, and mucilages, inulin. These all are the well-known soluble fibers. It slows your gastric emptying. That means, even that's what I said, that if you have a teaspoon of psyllium husk before you eat your meal, okay, you will not overeat your meal. Okay, it because it fills up your stomach, it fills up your intestine. Okay, it holds on to water and it fills up converts itself into gel like structure. Okay, which will fill up your stomach. Okay, and it will take time to come out, so you will not feel that hunger pangs more frequently. Then you have insoluble dietary fibers. Insoluble dietary fiber is a type which will not dissolve in water, but just like soluble dietary fiber, it is also indigestible. Okay, your body cannot digest it. And what your body cannot digest will not give you energy. Okay, so don't expect energy from this type of carbohydrates. Both of them are indigestible. But one gets dissolved in water, forms gel, the other does not even get dissolved in water. Okay, it will hold on to its structure, so it remains intact and moves through your digestive tract as it is. Okay. And this is the one that is great for constipation. Okay. If you suffer from constipation, insoluble dietary fibers are the best options. They also promote your regular bowel movement on a daily basis. If you have certain amount of insoluble dietary fiber, you will not suffer from constipation. Okay. It also improves your digestive health, reduce the risk of colon cancer, diverticulitis, and all. helps remove the waste completely out of the colon because you feel like going to the loo. Okay, when you have too much of insoluble dietary fiber, since it cannot be digested, the body will push it. Okay, out. Try to, the intestine will try to push it out of the system as soon as possible. So you will get this urge to go and defecate. Okay, so where do you find insoluble fiber? Usually, when it comes to food sources, whole grains like wheat bran, whole wheat, brown rice, vegetables like cauliflower, green peas, zucchini, bell peppers, that is your capsicum, nuts and seeds like almonds, sunflower seeds. And if you eat the fruit with its skin, okay, like grapes and apple, when you have an apple or a pear with its peel, any fruit that you have along with its peel, okay, that will add to the contribute to the insoluble dietary fiber. Legumes like again beans and lentils both have this, both have soluble and insoluble fiber as well. So is the classification clear to all? There is a table in your textbook as well. You can just go through that. So coming to the effects of fiber on nutrients and how it gets absorbed. Okay. When it comes to nutrient absorption, okay, dietary fiber, it can delay the uptake of nutrients because any food that has soluble dietary fiber, for example, it becomes into a gel-like consistency, and your enzymes have to reach to the core of it of the gel to get the nutrients out, which could be a quite difficult process for your intestine. Okay, so yes, it is creating the bulk, it is giving you all the benefits. Okay, but when it comes to nutrient absorption, it becomes a little bit tricky for your intestine to get hold of the nutrients which are stuck inside this gel like consistency. Okay, so this delay in absorption can lead to loss of nutrients. Okay, since along with soluble fiber, if insoluble fiber is also there, your body cannot, the system cannot hold on to the gel like consistency to get the nutrients as much as possible. It will be pushed forward. Okay, so nutrients, there are a chance that nutrients what you had will leave your body as it is without getting absorbed. Okay, then it has this water holding capacity, that is viscosity, especially in your soluble dietary fiber. Okay, so because of that, the pH of the your intestine changes a bit, size of the fiber particle, the degree of processing the food. If you are overcooking the food, the fiber content will be lost. Okay, so the water holding capacity will go down. Size of the fiber means if you are using the psyllium powder, okay, like psyllium husk, the isabgol powder, or the if you're using the isabgol husk, the coarsely ground one. Okay, if you mix both of them, equal amount of it, both of them in separate glasses of water, the coarsely ground one will have a better water holding capacity. Okay, the fiber that is completely finely ground like a powder, its water holding capacity will be slightly lost. Okay, so that is the effects of fiber when when you change its texture, size, and all. Okay. There is a delay in gastric emptying also because when this gel is created in your body, as soon as these fibers come in touch with your hydrochloric acid and water content in the food. Okay. When it gets mixed with all these things in the stomach, it will eventually form into a gel, which will slowly leave your stomach. Okay. So you will feel a sense of being like satiated for a longer period of time, which can help you avoid snacking or getting hunger pangs. Okay. So that is the beneficial part. So that helps in weight reduction. Unwanted snacking can be avoided. And but what is the drawback of it? When this gel-like consistency is there, your natural enzymes that your body produces is not able to mix with the food properly. Okay. When the food is not in a gel-like situation, it is not captured by this gel-like viscosity, it can easily mix up with the enzymes, get broken down quickly, and can be utilized, absorbed from the intestine. Okay, but this gel-like consistency is kind of a barrier to your to the programming of your enzymes. Okay, so that's why when you have too much of fiber in your diet, there are high chances that it could lead to diarrhea. Then absorption and binding capacity, the soluble dietary fibers, they have this ability to bind the enzymes and nutrients in the gastrointestinal tract. Okay, because of this ability uh, to absorb the substances, okay, it becomes fermentable. Okay, whatever is stuck inside the gel, inside the viscose gel, becomes fermentable for the microbiome. So the human body is not able to use it, but the microbiome in your intestine, small intestine, and large intestine will be able to use it, because by the time it is let out of your small intestine, it is out there in the large intestine. Usually, there is a lot of microbiome in the large intestine. Okay, so what the small intestine has not absorbed for the human host, okay, that becomes a treat for the microbiome. Okay, so that's how this gel like trap helps, okay, with the growth of good bacteria in your gut. And also bile secretion, okay, bile salts that are secreted by your uh, liver, which is held in the gallbladder, gets mixed in the duodenum. But if you have a lot of soluble dietary fiber, again this gel-like consistency will not allow the bile salt or enzymes to reach till the core of it, where lipids could be present, fat could be present. And if the bile salts cannot mix up with the fat, it will not be emulsified. Okay, the fats will not be broken down into small particles which can be absorbed by the intestine. That will not take place. So that's why fat absorption goes down because of increased fiber intake. And because of that, the serum cholesterol levels and all will go down eventually. So that helps with the heart health and all. Degradability and fermentability. Soluble dietary fiber, which converts into this gel, which can prevent a lot of enzymes from breaking it down. That becomes the food for the fermentable food for the microbiome. Okay, it undergoes fermentation, and because of this fermentation, the intestine becomes acidic in nature, which is good for certain mineral absorption like iron and all. Iron requires an acidic environment. Okay, so if you have good amount of fiber, this fiber will help create an acidic environment in your intestine because of fermentation that's taking place. It creates an acidic environment inside, ideal for iron absorption and also other nutrients absorption, because in acidic environment of the intestine, the nutrients get absorbed quickly. And when the fermentation process is going on, gas production does happen. Hydrogen, carbon dioxide, methane gases are produced, and it is excreted from your body in the form of flatus. Okay. Prevention of diseases. Non-fermentable fibers like cellulose and all that are found in your insoluble dietary fiber, they will not undergo breakdown even with the help of microbiome. They will not undergo breakdown. Their structure cannot be broken. So what use do they have in the intestine? They create the bulk. What cannot be broken will stay in its big size. Okay, and the body will try to get rid of it. Okay, so along with that, whatever feces is being produced, that will also be pushed out of the body. Okay, so in bulk, the feces is pushed out of the body just to get rid of the non-fermentable dietary fiber. Okay, that's how detoxification, easing the constipation takes place. So prevention of diseases with the use of dietary fiber, coronary heart disease. Coronary heart disease, what is coronary artery? Coronary artery is the blood vessel that supplies blood to the heart. Just like how heart supplies blood, heart pumps and supplies blood to all the organs in your body, heart also requires its own blood supply, okay, to keep functioning. So that blood supply comes from coronary artery, okay. And coronary artery, if your diet is unmanaged, if you have high levels of triglycerides and cholesterol in your diet, coronary artery blockages because of the cholesterol is quite high. Okay. And this is what leads to heart attacks, myocardial infarction, and heart attacks because there is a block in the coronary arteries. So, when you have dietary fiber, even the soluble, non soluble one, the soluble one, the soluble dietary fiber will create this gel, trap the fat inside it so that the intestine will not absorb it and it will be pushed out of the system. Okay. So cholesterol level, the amount of fat that is absorbed, digested and absorbed in your body goes down eventually. If there is no cholesterol, not much, you need cholesterol definitely because you need to produce hormone and all, okay, in your body. But when your cholesterol levels are controlled like this, fat level are controlled like this, triglyceride levels and all are under control because of the dietary fiber, eventually risk of coronary heart disease also goes down. Okay, so that's how fiber helps with CHD. Diabetes, uh, the frequently they feel hungry and thirsty. People who suffer from diabetes, okay, their appetite rate goes up because the body is not getting energy from the glucose. They need to take extra insulin and all to push your body to take up glucose, the cells, to push up the cells to take up glucose. Okay. So usually at any time of the day, a diabetic person's body, they have glucose, but not inside the cell, outside the cell, in the blood. Okay. So that's why their blood glucose levels are high and the cellular glucose levels are pretty low. And the cells, if they don't have glucose, they can't produce enough energy, and that's why people are always tired. Okay, it's a vicious cycle. So, how dietary fibers will help here is the soluble dietary fiber will keep diabetic patients feeling full for a long time so that they don't indulge in snacking. Okay, and they maintain their weight. Their weight control is achieved because there is no frequent snacking. Sure, small and frequent meals you should have, which is controlled, which is portion controlled. Okay, but regular snacking and all should be avoided. Okay, diverticulitis or diverticular, same. Uh, Here the insoluble dietary fiber has a major role to play because it cannot be digested, the structures stay intact, body wants to get rid of it. Okay, so there is no chance of irregular contraction taking place in your intestine, which could lead to diverticula. Okay, whatever feces is produced, it is not stored in the intestine, it is pushed out of the intestine as soon as possible. So there is very less chance of diverticula and all to take place. Okay, so that's how it prevents diverticula and also colon cancers. Colon cancers, the major reason is increased intake of red meat, okay, and triglyceride diet, high fat diet, increased use of these food, okay, meat which is cooked at very high flame, okay, all the type of meats cooked at very high flame have a risk of developing colon cancer. So when people take the insoluble dietary fiber, same, the feces is getting pushed out of the body. Okay, there is no room for constipation or change in the bowel pattern and all, because of which a mutation can happen and colon cancer can take place. So that's how it helps. Then weight control, as I mentioned, there is a sense of satiety, feeling of fullness, especially after eating the soluble dietary fiber. Okay, that gel-like consistency when it is formed in your stomach and in your gut, you already feel full. You don't want to overeat or overindulge. So naturally, that aids in weight loss. Coming to RDA, recommended dietary allowance for dietary fiber, do not take more than 60 gram per day. 30 gram for an adult is okay. 25 to 30 gram is ideal. Okay, more than that is not required. And kids who are at the age of 12, you have to multiply 6 by the age. Okay, that would be their fiber requirement. Sorry, 5 by their age. 5 gram of fiber multiplied by their age. Yeah, sorry, it's not the age, not to multiply with the age. It's just to add to the age. Okay, for example, if it is a 5-year-old child, you just have to add plus 5 or plus 6. So 10 to 11 grams of fiber is enough for a 5-year-old child. If you are dealing with yeah, for obesity patients also, same, 30 grams of fiber at least. If you take, that is enough. Because more than that, if you're taking, it will inhibit nutrient absorption. Even though you're using, if you're on a strict weight control diet, you should be very focused in making it low fat. Okay, low fat and low carbohydrates and high in complex carbohydrates. That should be the target. Does not mean that your nutrient level should go down. and that can happen with too much of fiber intake. So not more than 60 gram of fiber per day. You can refer the source as well, which is given. Both insoluble and soluble dietary fiber present in a specific food is given. Okay. In new textbook, the page number may slightly vary. The table name is dietary fiber content of food. How much gram of dietary fiber is there in every 100 gram of this particular food? And both the division in terms of soluble and insoluble fiber is given. It's not that if you take apple, apple only has soluble fiber. It's not like that. Apple has a combination of soluble and insoluble fibers. Okay. Assignment is not required right now. Later I will give. Is it clear to all?